Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist, and today I'm going to be talking about dissociative identity disorder, which used to be known as multiple personalities. So, dissociative identity disorder, or DID, is a condition where someone has lots of different personalities that live within one body. It's a condition that usually develops in early childhood, so most of us will have had lots of different parts of our identity at a young age, which then integrated around the age of 8 into a sort of more cohesive identity. Whereas people with DID, unfortunately, are likely to have had some sort of traumatic experience in early childhood, which meant that those different parts remained fragmented and never integrated into one cohesive identity. So, it can be that one part, or personality experience something traumatic, and their way of them protecting the other personalities is to create what we call like an amnesic wall or barrier to prevent the other parts from knowing that information. So the fact that it's contained the information and holds on to it separate from the others means that the others can then continue to function with day-to-day life. So it's essentially a defense mechanism. So it's very common that you'll find that some of the personalities will have bits and pieces of memories of trauma, and then there'll be some parts of the personalities that have very little awareness of the trauma, and those are the parts that normally do lots of the sort of functioning and day-to-day life difficulties. So that's kind of how the condition develops. And you will find that the personalities, there can be huge variation between clients in terms of how many personalities there are. Sometimes you can have 3, others might have 13. And each of the personalities will have their own age, gender, preferences, memories, mannerisms, physical health difficulties. For example, you may have within kind of one client, you may have that there is a male teenage personality who really doesn't want to be in therapy and just feels angry at the world and has a particular preference in music. And then you might find that there's another personality who is a very young child who struggles to communicate, who doesn't really understand what's going on, who just wants someone to sit with them and do colouring. You might find that you have a 40-year-old male personality who has sort of is struggling with depression, and that's, and you can wants to talk about things in a very philosophical way. And then you might have a 30-year-old male part who is very anxious and having flashbacks. So that within one sort of physical body, you will find that there is a lot of variation in terms of the different personalities. And my job is to try and get to know each of those personalities, to try and support them, teach them any psychological skills they might need for coping, and also to help them to work together. They're all sharing one body, and that can be very difficult at times. So I'm trying to help them work together. My goal is never to get rid of a personality, because actually they all serve a function and a purpose within that system, and I do my best to respect each of them in their own right as individuals as well. So that is a very brief overview of dissociative identity disorder. A lot of people struggle to understand it. It's not something that is commonly discussed in day-to-day life, and sometimes people can unfortunately misunderstand it and think that it means that the person is dangerous in some way. There are movies that unfortunately depict people with DID as being violent or superhuman or aggressive and that sort of thing. And actually, generally people with DID are just really lovely people who are trying to understand and cope with very difficult experiences. So yeah, I do recommend that you just try and treat them with kindness, the same as anyone else. If a personality wants to talk to you, then, just talk back to them and be friendly. It's not something to be scared of. In my sessions, I obviously, because I work with them a lot, I will get to know each of the personalities really well, and I will be able to tell which one I'm interacting with. Also, you can sometimes notice when they switch from one personality to another. So you might find that you are talking with a personality that is, sat upright and very talkative and, telling you about something. And then they might just kind of space out for a moment and just look like they're not perhaps fully present. And then you might notice there's a change in posture. They might suddenly sit back with their arms closed and their legs spread and just seem disinterested in what you're saying. Or you might find that suddenly they want to sit on the floor and, get out crayons. So based on trying to notice that switch between personalities where they might space out or that's the thing, and also noticing the mannerisms and the behaviour and the tone of voice and that's the thing of the next personality. I can usually then adjust my approach. So if a child personality comes forward, I'm going to talk in very simple terms. I'm going to do sort of activities like, colouring and that's the thing to help them to sort of calm down if they're distressed, or just distract them. Whereas, a teenage personality, we might be talking about music that they find really helpful for their mental health, or particular apps, or, they might be teasing me because I don't understand all the current slang terms that young people use. Whereas perhaps if an older personality comes forward, they might want to talk about things in much more depth and complexity and be learning more sort of sophisticated coping skills and that sort of thing. And I will also have to remember each of their preferences in terms of, which one really likes, the scent of tea tree oil and which one hates it. So I will have to know each of their preferences as well. If one personality has interacted with you, then when the other personality comes forward, they might not have any awareness of what you previously discussed with the other personality. So sometimes people might, act in a way that seems very out of character and then have no memory of it afterwards. And that's not them faking it, it's that they genuinely don't have an awareness of what the other personality was doing. We tend to use the metaphor of a car when explaining the awareness of different personalities. So the personality that's in the driver's seat will have complete awareness of what's going on and will have complete control over the body. There may then be a different personality in sort of the passenger seat, which is a personality that can see what's happening but doesn't have control over it. You may have personalities that have slightly less awareness, so it's like being in the backseat of a car, where you can kind of tell the general gist of what's going on or bits and pieces of it, but you're not really fully aware, and you have no control, and it might feel like almost like, did I dream that or did it actually happen? And then you might have personalities where they have no awareness whatsoever of what's happened, which is kind of like putting someone in the boot of a car where they don't know at all. They have no recollection of what's happened while the other personality has come forward. So it can be quite complex in that sense of sometimes there will be some shared awareness, sometimes there will be no awareness of what the other personality has done. And that can be very difficult because if one personality has perhaps done something very out of character, or sweared at someone, or sold something that you didn't want to sell, or gone out in clothes that you normally wouldn't wear, or that sort of thing, it's very difficult when then you come back round and you don't remember what's happened, you don't know how you've ended up in this particular situation, and people are expecting you to know those things, and perhaps getting frustrated or annoyed with you when you say that you don't understand what's happened or how you've got there and that sort of thing. So it can be very difficult to manage, not knowing what's happened whilst a different personality has come forward. It can also just be frustrating in terms of managing day-to-day life. If you have plans for the day and a different personality decides to come forward, then that can end up ruining your plans. Or if you've bought a pack of your favourite cookies and you're really looking forward to eating it, and then you find that actually one of the other personalities has come forward and they've eaten all the cookies, that can cause some frustration between the different personalities. Personalities can want very different things. They might want to date completely different people. So a lot of my work is almost like family therapy, in the sense that I'm working with loads of different individuals within one family or system, or one body. And so it's about helping them understand one another and work together and compromise on things, and maybe agree that, okay, if you make sure that you include this item in the shopping, I will leave your chocolates or your cookies alone. Or, yes, I won't come forward during that really important meeting that you have, but I would like some time in the evening to do what I want to do. So a lot of the time it can be very practical things like that as well, of trying to help them work together. So it can be quite a challenging job, but it's actually something that I really love. Working with dissociative identity disorder is something that I'm very passionate about, and I could probably talk about for many, many hours, but I will keep this as a very brief overview, just to explain to you, how the condition develops, the kind of variety of personalities you can have, what it's like when different ones come forward, and just some reassurance that they're not some dangerous, crazy people. They're just trying to cope with day-to-day life and difficult experiences. So I hope that's given a very brief overview. I will make a whole bunch more videos going into particular things in more depth. If people are interested, do feel free to either put comments below if you have questions, or send questions to me directly if there are specific things that you want to understand about dissociative identity disorder. But I hope that's been helpful as a very brief starting overview. Thank you.